Let's see what medical knowledge we can get from this video. Okay, what a beautiful sight to behold. I believe you all agree with me. I'm actually in awe of what I've just seen. Wow. So that video has simply shown how a fetus, which is an unborn baby, is in the mother's womb. Isn't it lovely and beautiful? So in that video, a cesarean section was taking place and the baby was carried out just like that, just to show the whole world how beautiful creation is. The fluid, so the baby in the womb, which is called fetus, is in an amniotic sac, which is surrounded by liquid called amniotic fluid. So the amniotic fluid is a clear, pale yellow liquid which surrounds the baby in the sac, and it helps to regulate the baby's temperature as well as protecting the baby from injury. It also helps the baby to move. It helps fetal movement. So for pregnant women, I believe you can identify with this when you feel that the baby is moving and somersaulting. It is the fluid that helps them to be able to do that. Isn't that beautiful? And also it helps them to develop their musculoskeletal organs. A bit of the amniotic fluid can actually be taken out for further tests, even during pregnancy, in situations in which you suspect that the baby may have some chromosomal abnormalities. The process of taking the amniotic fluid out during pregnancy is called amniocentesis. Keep that in mind. And as we all know, the exact quantity of a particular thing is needed for equilibrium. Equilibrium is kind of getting balance, right? So in essence, we do not want too much or too little. So in some situations, you have too much of this fluid called, and that condition is called polyhydramnios, in which the fluid is too much. The baby is literally drowning in the fluid. We do not want this. And what causes polyhydramnios? Polyhydramnios can be found in multiple pregnancies. So if you're carrying twins or triplets or quadruplets, you do need to be monitored by your healthcare provider for polyhydramnios, and appropriate intervention done if this happens. Also, babies with chromosomal abnormalities can have polyhydramnios, as well as gestational diabetes. And when we say too little, that means the fluid is not enough. So just imagine when the fluid is not enough, that means the baby is not able to move freely. The baby is the environment is dry. That sounds, not too good. When it is too little, it is called oligohydramnios. And what causes this? It can be found in late pregnancy. So for pregnancies that are going beyond 42 weeks, yes, they are likely, very, very likely to have oligohydramnios. The baby is getting, the area around the baby is getting dry, and the baby is not able to move as freely as possible. So we do not want this. Absolutely not. And also problems with the baby itself, abnormalities with the baby, or when there's rupture of the membrane. Yeah, so the membrane can actually rupture. In fact, the membrane do rupture, and this can signify labor. So rupture of the membrane, also called breaking of waters, might be the first thing the woman notices before she goes on to have or uterine contractions. When it is normal, it occurs after 37 weeks of pregnancy. But what happens when the water breaks before 37 weeks of pregnancy? This condition is called premature rupture of membrane. Is it good? No, we do not want this. The earlier the water breaks, the more at risk the mother and the baby is. So how do you know that you've got premature rupture of membrane? Seeing that when the water breaks, it can either be slowly leaking or come as a gush of fluid. It's more tricky really when it is slowly leaking. In that case, most women can confuse it with urine. Simply to differentiate from urine and fluid, amniotic fluid, it's simply doing a home testing by putting a pad and taking out the pad after it is soaked with the fluid, check the color and check the odor. So if it is amniotic fluid, you expect it to be clear and odorless, as against urine that can be yellow and smells like urine. Absolutely, ammonia. So takes us to the next question. What causes premature rupture of membrane? In most cases, the cause is unknown. That is called idiopathic. But in some situations, it's been found to be caused by infections of the womb, cervix, which is the mouth of the womb, or the vagina. So if you notice that you become unwell, you develop temperature, or you have abnormal vaginal discharge during pregnancy, don't sit on it. Make sure you see your doctor. Also, pregnant women that smoke can have premature rupture of membrane. So if you have the habit of smoking and you find yourself pregnant, it is very important that you try your possible best to stop smoking. Also, having premature rupture of membrane in previous pregnancies can predispose you to having another one. So, in summary, to keep things simple, if you notice that you have broken your waters or your waters are broken, and more especially before 37 weeks of pregnancy, definitely do not sit at home. Call your healthcare provider for further investigation and management. It is very, very important. I hope we've been able to learn one or two things from this video today. Kindly subscribe to this channel and click on the notification button to get notified when new videos drop. Thank you. See you later. Bye.